One of the things I talked about last week is we are now we're asking our local health departments to give us stories to really explain how people get infected, because I've always found that stories, are instructive. And I think there's a natural tendency that we all have, myself included, that if we're around family, if we're around friends, we're not as concerned. We may not be as likely to wear a mask. We may not be as likely to keep a social distance. And what we've seen is just a lot of casual events in our lives where people are not careful, they don't wear a mask, they don't social distance, can lead to a lot of outbreak. Couple stories. This began on a 40-minute ride from one county in Ohio to a lake, and this was on the 4th of July. Here's what happened. 4 people rode together in a car to the lake. Dad, mom, their adult daughter, and a family friend. The family friend had the virus, but certainly did not know it. The family friend ended up infecting the dad, who ended up in the ICU in Pittsburgh. This dad has a business that had to temporarily close. 2 of his employees then tested positive. Their daughter also got sick. She had mild symptoms. She was in the process of being hired for her first teaching job. Now that process is delayed because she has to have 2 negative coronavirus tests for the process to move forward. Luckily, the mom didn't get sick. However, the reach of COVID-19 certainly did not even stop with that immediate family. The mom's mother in her 90s and 2 caregivers. The mom's mother's in her 90s. She has 2 caregivers who have been around the family after exposure. They both tested positive. One of those caregivers ended up in the ICU. A different patient who the caregiver also took care of, also in her 90s, also got sick. It just goes on and on. After testing positive, the family friend's employer had to temporarily close so that the other stylists who worked the salon could quarantine. Luckily, since they wore their masks, none of them got sick. However, the family friend passed the virus on to her husband. His business had to temporarily close while his employees quarantined. One of his employees was getting married and found out on her wedding day that she would need to quarantine. A different employee was on vacation and had to stay in the hotel for the rest of the vacation. Unbelievable. 10 people got sick. 2 people ended up in the ICU. 3 businesses were temporarily closed. Co-workers and family members were worried, inconvenienced, quarantined. The local health department's team is still monitoring people who were exposed, and they expect to learn of additional COVID-19 cases stemming from that single car ride. Another example of how one person can infect others involves a birthday party in the eastern part, also in the eastern part of the state. A woman went to get tested, ultimately tested positive, but while waiting to receive her results, she decided to host her 50th birthday party with about 20 guests. 2 of those guests run a home daycare center. One of them tested positive, and they had to temporarily close the daycare. A different guest, who also works at a foster care group home for teenage girls, also tested positive. Now that foster care has 9 employees and 6 residents who have all tested positive. One of the teens is in the hospital. In another county, there was a charitable fundraiser in mid-July with 100 to 200 people in attendance. It was a poker run that had dinner afterwards with a band on site. To date, they've had 46 cases tied to this charitable event. 31 of these cases are people who attended the fundraiser. 11 cases are people who gave the illness, who they gave the illness to. 4 cases are still being investigated, but have ties to the event. Look, we don't bring these up to shame anybody or to say, they did something bad. We simply are trying to show as what we're seeing, and share with you what we see every day, and that is stories of average Ohioans who, because they're not as cautious as they should be, or they might be, we end up with a very, very significant spread. I think we can look at these stories as just instructive of how tough this virus is, how it spreads, and how it certainly spreads from people who have no idea that they have the virus at all.